history taking is a little bit different than that of the other subjects of the final year. So we will start with introduction. If I would say one of your student about your introduction, what will you say? Your introduction, please. Your name, your age, and you belong from? You are from Nepal. So this is the introduction, and same is the introduction of the patient. You have to write Mrs. Fatima Bibi, wife of Javed. These are the supposed name. Her age is 30-year-old, married Muslim lady. ठीक है. Gravida or para. Gravida mean how many times she got pregnant. Gravida, how many times she got pregnant. Is she now pregnant? Then gravida. Gravida 3, para 2. Para mean how many times she has been delivered a baby. Okay. Para 2, A mean abortion. Okay. So you have to count the gravida, para and A, abortion, and then she is at 37 or 38 week of gestation with presenting complaint. And before that you have to tell the address of the patient. She came from Lodhra, she came from Karol Pakka. The importance of address is from where patient is coming, from periphery area, from which area, and admitted from COD, casualty department, or gynae outdoor. This shows severity of the disease, whether she land in emergency with some heavy PV vaginal bleeding or some labor pains, or she came in the gynae OPD and she have been diagnosed with hypertension or diabetes during pregnancy and she has been admitted. So in the introduction, patient name, her husband name, her age, gravida, para and abortion, and now at what gestation she is, and she came from Lodhra or from which city she is coming, and she admitted through outpatient department, gynae OPD, outpatient department. You are supposed to not to use abbreviations. OPD, COD, no. Outpatient department, gynae outpatient department, casualty. Okay. And presenting complaint. Introduction. Then presenting complaint. Presenting complaint will be in chronological order and in the language of the patient. Gestational, amenorrhea, 7 months, and then she has been admitted for what? For control of blood pressure or for anemia correction, for build up HB, whatever the patient said, that will be the presenting complaint. She has been she can complain of labor pains, she can complain of pervaginal bleeding. So that will be the second presenting complaint after gestational amenorrhea. Then comes the HOPI. These are abbreviation for your own learning and not for the viva purpose. In the viva, in the exam, you will not use any abbreviation. History of presenting illness. It will be divided in 3 parts, 1, 2 and 3. First trimester, second trimester and third trimester. Okay. First trimester, second trimester and third trimester. History of presenting illness. This will start by asking the question to the patient that how you got to know that you are pregnant. Before pregnancy, do you have normal menstrual cycle or not? Regular normal menstrual cycle or not? Or you conceived on any treatment or spontaneously without any treatment? Okay. So the opening sentence will be, how did you know that you are pregnant? Okay. And did you take any medicine or you conceived spontaneously? When you visited doctor first time, that will be first antenatal checkup. And did you take have you taken any medicines or your baseline test have been performed in the first trimester or not? Do you have any fever with rash, vaginal bleeding or vaginal discharge or any other severe disease that you have been admitted in the hospital or not? That will be the history of first trimester. Okay. In ideal patient, in book patient, the history will be, my patient conceived spontaneously on regular menstrual cycle her pregnancy was confirmed by urine for pregnancy test or by having vomiting and nausea, symptoms of pregnancy, okay. And she has been visited to the local lady doctor first time in the second month of the pregnancy, where her blood pressure was checked and her ultrasonography was performed, and she was told about single alive intrauterine pregnancy of 8 week or 7 week. That has been what has been told to the patient, and she has been prescribed folic acid supplement, which she took regularly in the first trimester. There is no history of high grade fever with rash, vaginal bleeding, vaginal discharge or any other serious illness in the first trimester. This will be the whole paragraph of first trimester. And if you will speak in front of examiner in such a organized way, then you will not only pass, you will have good marks in the viva, okay. So these sentences you should write in your notebooks or in your mind, that how I have to start my history. After introduction and presenting complaint, the history of presenting illness has main role. This is the main stem of your history. If the patient is unbooked, in our area mostly patient come from village and they are unbooked cases. They don't know when they got pregnant, they don't know about the pregnancy, even in the they landed in the hospital without any previous checkup. Then you will start that my patient is unbooked case, and she has been breastfeeding her child, so she don't know when she got pregnant, or she conceived during lactational amenorrhea, so her last menstrual period is not confirmed, and she first visited to the doctor at 7th month of gestation when she got pervaginal bleeding or any other symptom, headache or something. So the first trimester history will be skipped if the patient is unbooked case, because she did not went to any doctor in the first trimester. So you will explain in the same way that my patient did not visited any doctor in the first trimester, she did not take any folic acid or supplementation, and she was not knowing about her pregnancy till the 4th month of gestation. Whatever patient told you, you have to modify in the same manner, okay. Mostly patient came here without any booking visit, without any antenatal care checkup, okay. So this is the history of first trimester. Then comes the second trimester. Second trimester start from the 4th month of gestation. So you will start with the fetal movement. My patient felt fetal movement at the start of 5th month of gestation. Fetal movement is called quickening. What is called? Quickening. So you can use the word of quickening. My patient felt quickening at the start of 5th month of gestation, and she went to the radiologist. She has been referred to the radiologist for anomaly scan, and her anomaly scan was performed, and according to the patient it was normal. There was no any fetal abnormality in the anomaly scan. उर्दू में या उसमें अपनी लैंग्वेज में पेशेंट से पूछेंगे कि कोई आपका 5वें महीने में बच्चे के अज़ा में नुक्स होने वाला कोई बड़ा अल्ट्रासाउंड हुआ था जो अल्ट्रासाउंड स्पेशलिस्ट से, तो मोस्टली पेशेंट यहाँ पे नहीं करवाते, लेकिन पूछना आपने ज़रूरी है कि क्या किसी बड़े अल्ट्रासाउंड के पास डॉक्टर वाले के पास आपको रेफ़र किया गया था या नहीं. सो अगर वो कहती है नहीं किया गया, तो फिर तो आप कह देंगे कि हर अनॉमली स्कैन है. सो अपनी ज़बान में आप क्या पूछेंगे कि जो चौथा, 5वां और 6वां महीना है, इसमें क्या आप किसी डॉक्टर के पास गए थे, क्या आपने चेकअप करवाया था, क्या खून पेशाब के टेस्ट इसमें दोबारा पूछेंगे. अगर उसके फर्स्ट ट्राइमेस्टर में नहीं हुए तो आपने पूछना है कि ब्लड टेस्ट, बेसलाइन टेस्ट कौन से होते हैं. पता है आपको 5 बेसलाइन टेस्ट क्या होते हैं? नाम बताइए. CBC, BSR, यूरिन कंप्लीट, वायरल मार्कर्स और ब्लड ग्रुप एंड RH फैक्टर. तो बेसलाइन टेस्ट आपने उससे पूछना है कि आपके हुए थे या नहीं हुए थे. हर बेसलाइन टेस्ट हैज़ बीन परफॉर्म्ड एंड शी वाज सेटिस्फाइड. She has been satisfied by her doctor that her tests are normal, her blood pressure is normal, and her ultrasound is normal. Her baby growth is going well. Growth is very important in the second trimester. Growth of the fetus, amount of liquor, localization of the placenta. These things are done in the second trimester. And last में फिर वही question, there is no history of vaginal bleeding, no history of vaginal leaking, vaginal discharge, high grade fever or any other acute illness. Okay. Then comes the third trimester. Third trimester starts 7 months to 9 months, 7, 8 and 9 months. We will start by asking about the tetanus prophylaxis. That my patient got tetanus prophylaxis in the third trimester. At 7th and 8th month of gestation, she got tetanus prophylaxis, and at the end of the 8th trimester, she was having symptoms of headache, dizziness, pain, epigastrium, for which she went to the local doctor, and her blood pressure was raised at the time, for which she has been referred to the tertiary medical center for blood pressure control and further management of the pregnancy. ये मैं एक example बता रही हूँ, just for one example. Or otherwise she has having symptoms of dyspnea, fatigue, and her HB was according to the patient was low, for which she has been referred to the tertiary care center, gynae unit. She has been admitted to the gynae unit 2 for the anemia correction. So in the third trimester, tetanus prophylaxis, history of vaginal bleeding, vaginal leaking, labor pains थी या नहीं थी, क्योंकि 4 मेन कंप्लेन है जिनसे पेशेंट इमरजेंसी में लैंड करता है. हिस्ट्री ऑफ लेबर पेन्स, हिस्ट्री ऑफ ब्लीडिंग, vaginal bleeding, हिस्ट्री ऑफ vaginal लीकिंग, गश ऑफ वाटर डिस्चार्ज और डिक्रीज फीटल मूवमेंट. ये चारों आपने थर्ड ट्राइमेस्टर में लाजमी पूछनी है. लेबर पेन्स, लीकिंग, ब्लीडिंग, डिक्रीज फीटल मूवमेंट, 4 कंप्लेन. ये इमरजेंसी में पेशेंट इन 4 कंप्लेन के साथ लेबर रूम में लैंड करता है. ठीक है, तो अगर इनमें से कोई कंप्लेन थी तो वो इमरजेंसी में डील हुई होगी और फिर वार्ड आई होगी. In the last paragraph you will explain, here admitted in the ward, her tests have been performed, blood tests have been performed, her ultrasonography has been performed, and she has been prescribed certain injections, certain medicines for control of blood pressure or for build up of HB. She has been transfused blood, whatever she has the complaint. Okay, I am giving only examples. You will take history of the patient and I will rectify it. So the history of presenting illness will be completed when you will explain that here admitted in the ward, what treatment have been given and what plan of delivery have been decided. She have been decided to have a C-section after 2 days on planned date, or she has been planned to discharge and follow up after 15 days after control of blood pressure or after build up of anemia. So you will complete your history of presenting illness by giving the plan to the patient, and patient will know her plan. Her delivery will be planned if she is having 37, 38 weeks, or she will be planned to discharge and follow up in the gynae OPD. This is the complete history of presenting illness. Then comes the past gynecological history. Gynecological history is her age of menarche was 11 years. She has normal menstrual cycle before that, 7/28 days cycle, and her there is no history of intermenstrual bleeding, postcoital bleeding, dysmenorrhea, dyspareunia. Do you know these terms or not? Do you know the meaning of dysmenorrhea, dyspareunia, postcoital bleeding and intermenstrual bleeding? This will be taught to you in detail in gynae portion. Okay, so you have to label it in the 2 lines, that there is no history of intermenstrual bleeding, postcoital bleeding, dysmenorrhea, dyspareunia or contraception. Did she practice any contraception or not? This is very important question. Okay, couple never practice any method of contraception, or couple practice contraception in the form of condom, in the form of pills, or in the form of injections or IUCD. Whatever patient told you, you have to document it. Okay. Then comes the after gynecological history. Then comes the past medical history. There is no history of hypertension, diabetes, asthma or any chronic disease in the patient. Then past family history, same. There is no family history of hypertension, diabetes, asthma or tuberculosis. Then comes the past surgical history. She have been operated for gallstones 2 years back. Her cholecystectomy has been performed, or her appendectomy has been performed in the past surgical history. Okay, or kidney stone has been removed in the past surgical history is important, whether any surgery has been performed or not on patient. If she has having previous scar, then this will also come in previous past surgical history. But before all these histories, you have to take past obstetrical history, that I forgot to tell you. So after HOPI, what will come? Past obstetrical history. That is very important in OBS, past OBS history. After past obstetrical history, you will give the all the detail of gynecological history, medical history, family history, personal history. She is not addict, she is having good habits, non-smoker, non-addict, having good hygiene, you know, personal history. And then socio-economic history. Socio-economic history is very important, that depend upon her socio-economic history, that what type of diet she is taking. Okay. In past obstetrical history, you will tell about how many children she have before. Now she is pregnant, she is gravida 3, para 2. Previously she has been delivered 2 babies, both are delivered by C-section. Her first baby was male, her first baby was male 3 years ago, alive and healthy. There is no antenatal, intrapartum or postpartum complication during that pregnancy. Antenatal, intrapartum and postpartum complications, and you have to ask about these complications to the patient. There will be wound infection in the after C-section, or any hemorrhage during pregnancy or during delivery, so you have to probe about the any complications. Her second baby was delivered by C-section 2 years ago, that was a female baby, alive and healthy. There is no antenatal, intrapartum or postpartum complications. Both babies were breastfed and vaccinated. Breastfeeding and vaccination is the compulsory question to be asked by the patient. Breastfeeding and vaccination of the previous babies. Okay. Now she is pregnant. Now she has no history of any abortion. So previous all obstetrical history you will ask about in detail. Then you will start gynecological, family, personal and socio-economic history. So history of presenting illness and past obstetrical history are compulsory to pass the viva. Write in your mind, you have to take daily on history on daily basis, and you have to ask this question on daily basis कि introduction क्या था, उसकी presenting complaint क्या थी और उसकी history of presenting illness क्या थी. इन जो मैंने आपको ये बातें बताई हैं, इनमें से कोई क्वेश्चन हो. Do you understand? What is your name? Abdul Shakur from Somalia. So you understand my lecture, my English? Thank you so much. Any question from Nepal? No question. Any question from Pakistan? No question? Okay, thank you so much.